If your surgeon has made the recommendation of penile prosthesis surgery, it's not one that the surgeon has made lightly. It is well recognized that this is a surgery, and every surgery has risks. However, your surgeon has looked at these risks and has determined that the relative benefit of having this surgery for your erectile function is greater than the risks associated with the surgery. Having said all of that, the surgeon makes this recommendation because everything that has happened before this surgery either hasn't worked, isn't currently working, or will not work. And if that's the case, this represents a last option. Even though this is an end-of-the-line option, it's a very good end-of-the-line option. Satisfaction rates are very high with the patient, about 95%, and with the partner, around 90%. It also represents the only form of recommendation that reestablishes most of what you may have lost with erectile function. So this represents a treatment that will allow you to have spontaneous in-the-moment erections. It also allows for the erection to be present for as long as you would need it to be present. These are very important things when it comes to erectile function, intercourse, and taking away the anxiety that's associated with erectile dysfunction treatment. The actual procedure itself starts with cleaning. The area is cleaned for approximately 20 to 30 minutes, sometimes even 45 minutes, to make sure that there is as little chance of infection as possible. Next, the patient is draped in such a manner that no skin contamination can occur during the procedure itself. The incision is made and the penis is measured appropriately. More specifically, what that means is that the corpus cavernosum is sized appropriately to determine the right size of prosthesis to place. Next, the reservoir is placed. That reservoir then is used to later connect to the rest of the tubing being the cylinders, the pump, and the tubing between the cylinder and the pump. Next, the cylinder and pump are placed appropriately, connected to the reservoir, and then tested. We test to make sure that not only the cylinders are placed in the correct location, but also to prevent any kind of problems that are mechanical in nature, make sure that there's no leak, and make sure that the prostheses are functioning appropriately and there's a good outcome afterwards. Next, we deflate the prosthesis and we close. The way we close is through multiple layers of sutures and closing tissue layers in a stepwise manner. After we perform that, we perform the placement of the gauze and dressings. Sometimes this can actually be fairly complicated. After all of this is done, that is when the patient is woken up and transferred to the post-anesthesia care unit. Depending on the patient, the surgery can be done ambulatory or typically with a one-night stay. Most patients can be done ambulatory, and this is common practice for myself as well as a lot of prosthesis surgeons. Very rarely a patient will need to stay overnight for one or more nights because of underlying medical issues that make it impossible for the patient to go home immediately afterwards. The most important clearance that's needed oftentimes with penile prosthesis surgery is cardiac clearance. This is because in a lot of forms of erectile dysfunction, there is an underlying problem with blood flow, and that blood flow can lead to issues with the heart. If there is no history of cardiogenic or vasculogenic problems, then that surgery clearance is not needed. However, in a minority of patients, there are other medical issues that require a clearance. Most of the time, these require a specific specialist to clear the surgery, and in those cases, it's important to get those clearances from those specialists. Transportation is needed after penile prosthesis surgery. Most of the time, these surgeries are done ambulatory, and the patient is in no condition to drive home by themselves. Sometimes penile prosthesis surgery is done with an overnight stay in a hospital or a 24-hour ASC. If that's the case, then transportation is still necessary because the patient may not be in a position to be able to drive after surgery. Your surgeon will give you instructions before surgery that can help to optimize outcomes afterwards. Please follow those instructions as they're very useful to help prevent problems after the procedure and to help the surgeon give the best possible outcome. However, generally speaking, there are some useful recommendations that can be performed before surgery that may very well help with the outcomes afterwards. The first is the use of a vacuum erection device. The vacuum erection device can help to reestablish blood flow into the penis, and that can help a little bit to establish length during the procedure. What can happen with erectile dysfunction is there can be some atrophy that occurs that can end up leading to even some scar tissue within the penis. And a vacuum erection device can help to break up some of that scar tissue and to allow for adequate length so that at the time of procedure, the most amount of penile length as possible is given. The way to do that is, at least for a daily use of the vacuum erection device, ideally 1 to 2 weeks before surgery. The next is the use of a cleaning agent before surgery. The recommendation is used a chlorhexidil or a hibiclens-based agent before surgery, and this can be done even a day or two before surgery, to be done daily. That can help significantly to help to prevent the chance of an infection. Now, oftentimes this doesn't take the place of the cleaning that will be happening at the time of surgery and even in the preoperative area before surgery. Having said that, the more cleaning that's used beforehand, the more useful it can be. However, it's important to remember that some people have very sensitive skin, and a dermatitis can occur if too much cleaning happens before surgery. The next question I get often is whether or not the patient should shave before surgery. We often say that shaving can be useful before surgery. The only recommendation for that would be that if the patient isn't used to shaving, it may not be a good idea to do so. Shaving can sometimes lead to ingrown hairs, and if not done properly, those ingrown hairs can be a site of infection that can either prevent the surgery from happening or risk the chance of infection during surgery. Generally speaking, either a nurse or the surgery scheduler will give you very specific instructions in terms of the medications that you should and shouldn't take before surgery. If possible, it is useful to come off blood thinners before surgery. This includes aspirin, Plavix, or any type of Coumadin, Eliquis, Brilinta, or other types of antiplatelet or blood thinner medications. Having said that, there are some patients that cannot come off of these medications because of cardiac risk factors. In those cases, it is very important to coordinate surgery with the attending cardiologist or hematologist to make sure that those medications can be stopped and started in the most safe way possible. Other than that, the general recommendation is to take medications as directed up until the day before surgery. Your surgery scheduler or the surgery center itself will give you specific recommendations on what medications to take either the night before or the day of surgery. The most important dietary recommendation is to make sure to not eat past midnight the night before surgery. Other than that, it is possible for some surgical centers and anesthesiologists to be okay with necessary morning medications with a sip of water. However, it's important to make sure that you verify that with your surgeon and or your anesthesiologist before surgery. Usually, it's not necessary to pack anything specific for the day of the surgery. Oftentimes, the surgeon will give you specific instructions to take home at the time of surgery. Some surgeons prefer to do this before surgery so you have it at home during surgery. It's important to bring all the necessary registration materials for the surgery itself, and usually the surgery center will tell you exactly what those registration materials are. As a general rule, I recommend all my patients shave before surgery. Having said that, if the patient is not used to shaving, I do not recommend them to shave before surgery. The reason for this is that There can be issues with either ingrown hairs or excessive bleeding that sometimes can increase the risk of infection at the time of surgery. As such, if the patient is comfortable or used to shaving before surgery, I highly recommend that they do so. Otherwise, I do not. You can expect to arrive at the surgery center approximately 1 to 2 hours before your surgery. The reason for this is to allow for a stress-free environment. This time is important to allow for any kind of problems with registration to be resolved and to allow for appropriate time for you to get acquainted with the center and the nurse that will be taking care of you. The nurse will take you to the preoperative area, at which point a nurse or another member of the medical team will put an IV in. That IV will then connect to saline that will either be used with the conjunction of antibiotics at that time or later. You'll talk to the anesthesiologist who will go over the risks of the anesthesia and answer any questions that you may have about the anesthesia. The surgeon will also be there so that you or any family members can talk about the surgery, any questions that you may have about the surgery, and any questions that may have come up since the last time you talked to the surgeon. At that point, the nurse will verify all the information and you'll proceed to the surgery itself. Oftentimes people don't remember this step because the anesthesiologist has given some medication to allow for the patient to be at ease. At this point, once in the actual operating room, the actual surgery begins. The surgery can take anywhere from 1 to 2 hours, depending on the complexity of the surgery. Most of that time is actually not surgical time. Most of that time is spent preparing the patient and waking up the patient with the appropriate amount of anesthesia. Afterwards, the patient will be in the recovery room, and that time in the recovery room may seem like a little bit of a fog afterwards because even though the anesthesia has stopped, there still will be some residual effects for a little while. The patient may not remember a whole lot from this, but the nurse is there to make sure that the patient is safe and that there are no issues after surgery. This usually occurs for approximately an hour, possibly 2 hours, depending on the patient. After that, the patient will go home. Oftentimes, the surgeon will talk to the patient, but sometimes the patient doesn't remember because of the anesthesia rather. But having said that, the surgeon will come and talk to the family members as desired by the patient to make sure that any kind of additional instructions are given. And also to discuss the surgery, to discuss any possible complications, but mostly to reassure the patient that everything is fine and the family that everything is fine. Afterwards, you'll leave the surgery center if the case is done ambulatory. Occasionally, the patients are kept for an overnight stay, but most of the time the patient will go home that day after surgery. The next day, we see the patient in the office to remove some of the dressings, to remove the catheter, and to discuss the next steps. It is very common to be nervous about any kind of surgery, certainly one this delicate. We expect you to come in with a certain amount of fear and apprehension, and that is completely normal. Having said that, we will walk you through the whole process. We will talk to you about the surgery, we'll talk to you about what we are doing at every step, and we'll talk to your family during and after the procedure to make sure that you are well informed of the procedure itself and what to do afterwards, and certainly what the expectations are after surgery. It is very common to have questions before surgery. It is more common to have questions after the surgeon has talked to the patient and to realize that there's a question that was remaining that may not have fully been addressed. There are many resources to address these questions. If you can't find the answer on the website, please feel free to call the office. We will go step by step with you to discuss what to expect before the surgery, during the surgery, and any questions that you may have, we'll address them appropriately.